there was the opportunity to develop partnerships with the nurseries around the state to improve the health of babies that are being born there, as well as coordinating efforts for those babies that have to be transported to Children's. We've had those relationships in the past, but we felt like we could elevate that to truly do something transformational.
The hope was by establishing the Alliance and finding partners around the state that had like-minded ideas of wanting to move that needle on newborn care, that we could really improve infant mortality in the state of Arkansas.
The staff at Conway Regional and our nursery and labor and delivery is honored to be the first hospital in the state to participate in the Nursery Alliance with Arkansas Children's Hospital. Our physicians have worked hard with our medical consultant, Dr. Ashley Ross. We've been retrained in neonatal resuscitation. He has come up and given us talks on respiratory care, including CPAP administration. So to me, an educational component that we share both with physicians, nurses, and respiratory therapists has been a big part of the Alliance with Arkansas Children's Hospital.
Conway Regional was an excellent first choice for the Arkansas Children's Nursery Alliance. They were already providing incredible quality of care, scope of care, and it's incredible what we've accomplished in the first year with them as a partner.
This relationship has enabled our team to have that support system behind us, and that has given us the confidence in order to take the care of those infants one step further. We've been able to keep twice as many infants between 32 weeks and 35 weeks just in the one-year relationship that we've had with Children's.
We ended up at Conway Regional to have her. I planned for this for months and months and months, and everything, the birth plan went as normal and everything was exactly as I wanted it to be, but nobody plans for a sick baby. When we realized that she was sick, they immediately took her into the nursery at Conway Regional. The doctor came in and explained what was going on and gave me the details of how sick she really was. So it's extremely emotional because it was really scary. But everyone here was so wonderful and they told me exactly what was going on. They initially told me that she could potentially get sent to Arkansas Children's Hospital. And that scared me even more because I was still recovering here at Conway Regional. And so I really needed her here with me for my own recovery as much as I did for hers.
Baby Olivia was born with a little bit of respiratory distress going on. We initiated some nasal CPAP to help her breathe. That's a pressure that helps open up her lungs as she's breathing. As we examined her, we determined she had a pneumonia that was present at birth.
Families such as Courtney's would have had to go to another facility to start their care. But now we have the capability, we have the equipment, the resources, the confidence in order to keep that child in our own facility, to keep the care close to home, to keep the family intact.
We are in the process for our year 2 goal of looking at data from the past year. How many babies did we keep of certain gestational ages? What were their diagnoses? How were they fed? So that we can look with the statisticians and neonatologists at Arkansas Children's Hospital to improve the quality of care should that situation arise next year.
We just recently celebrated our 1-year anniversary with Conway Regional in our Nursery Alliance, which was a really exciting milestone. We've already been able to demonstrate improved outcomes for the patients that are delivered at Conway Regional, and now we're excited to be adding future Alliance partners.
By having other hospitals in the Nursery Alliance, it helps establish a network of care for newborns in the state of Arkansas. It's not just Arkansas Children's working with other hospitals, but other hospitals within the network working with each other to move the bar on infant mortality in the state of Arkansas.
That sharing of information is really where the value is, and then that translates into having a sustainable, increased ability to take care of those babies where they are being born.